Hey, how you doing? Let me just move my insulin pump out of the way. So, my son, my youngest one, he was watching was it a film theory? I believe it was a film theory. It may be an older film theory, but post Matt Pat. Miss you, Matt Pat. God bless you. And the word psychiatry and psychology, psychiatrist, psychologist, were being used interchangeably. And me being a psychologist, admittedly experimental psychologist, but me being a psychologist, I was getting slowly amped, irritated, and they were being used interchangeably. And I kept saying, they're not the same thing. They mean completely different things. They're completely different professions. They do different things. And my son kept saying, Dad, shut up, shut up, shut up, stop it, keep quiet, you're irritating me. And that was the birth and genesis of this video. Psychiatry versus psychology. Is this an oversimplistic simplification? Yes, of course it is. One gives pills, the other helps you get better. But it highlights what I feel at its core is the underpinning of two very different approaches to dealing with mental illness, and which is based on two very different underlying models of human behavior. One, the medical model, a biological model, that everything can be reduced to a biological underpinning, the medical model, hence you get a pill. And the other, based on what's called the biopsychosocial model, which is based on the more Gestalt approach to human behavior, which is that we are more than the sum of our parts. So yes, you can have a biological underpinning, but that'll only get you so far to understanding the complexity of human behavior. That simple distinction for me is at the core of understanding the difference between psychiatry and psychology. And it's also the difference between understanding the training that psychiatrists get, psychologists get, which feeds into how you as a patient would get treated differently by a psychiatrist versus a psychologist. All the way up to why psychiatrists bill at 15-minute increments, and psychologists are only allowed to bill at the shortest increment, which is a 45-minute increment, maybe 50 minutes. So this is not a slight against either profession or an endorsement of either profession. You might ask yourself, Dave, why are you talking about this? Yes, you're a trained psychologist, but by definition, you have already said you are not a practicing clinical psychologist, nor are you trained as a clinical psychologist. This is true, but I was admitted into graduate school as a clinical psychologist. I entered grad school as a clinical psychologist at Kent State University, and I transferred into the experimental program once I was in there. We will get into all of these and the withers and why-fors in the next few minutes as we explore psy versus psychiatry versus psychology. On to the next part. So just a quick reminder why we're here. This is Doc Dave's Got Feelings. I am Doc Dave. Yes. This is a new psychology educational experience. Did you like my opera voice? This is the kind of irreverent palate cleanser that you never knew you needed. And as we go into this video, we are going to explore some of the similarities and differences between psychiatry and psychology, my chosen profession. On to the next part. So, not surprising to those of us who are on the internet a lot, but when you look at or look up psychiatry and psychology, you will find that there is a clear bent and preference towards psychiatry as a professional discipline. In fact, you look up, you don't even have to go that far off the first page of Google search results. We all know Google can be rather biased. However, in this case, the Google search results, at least the first, I don't know, 550 million thousand results are written by MDs. And they tend to prefer, in a self-serving kind of way, their own profession. So you'll see page after page and comment after comment from medical school places saying, oh, it's so hard to become a psychiatrist. It's so much harder to become a psychiatrist than a psychologist. To which I will say, just right off the bat, I call bullshit! It is not. On any objective level. I mean, on some level, it's stupid to even try and compare. But let's just take, just at a simple level, acceptance rates to get into school. The first thing to note, there is no entrance into psychiatry school. There is no psychiatry school. Psychiatry is a choice. You get a rotation to get a discipline after you enter into med school. So this is the most recent data we have by professional organizations. Unlike medical school, there actually is clinical psychology programs. You apply to specifically enter a clinical psychology program. There are APA accredited clinical psychology programs. Are there other type of clinical programs or programs that deal with more counseling type thing? Yes, I'm not including those degrees. There's other programs. Are there people who collate those statistics as well? Yes, but this is not what we're talking about. We're talking about clinical psychology, the other half of my profession, and MDs. So when you talk about clinical psychology and you're talking about APA accredited programs, the top of the profession, because for med school, I'm not including the ones in Venezuela. I'm including American Association of Medical Colleges. So the top of the line accredited colleges. Look at that. 42% of the people who apply get in. That's almost half. It's fucking easy. But with clinical, and that's just general med school, or at least relatively easy. I was actually shocked at that number. And that's like last year. Clinical psychology, however, 1 out of 10. 1 out of every 10 applicants for clinical psychology get accepted into the top of the line, gold standard, most difficult training programs in the country. And in both cases, med school and clinical psychology, that's just getting in. Whether you stay in that program, that's another kettle of fish altogether. So that's the getting in, and then there's attrition after that. Fewer and fewer people actually graduate from those programs. And again, you go straight into a clinical psychology program. You get a number of years of training in a clinical psychology program. Then you go for a clinical psychology internship. Then you get a supervision. Then you get licensed, and then you can hang out your shingle and practice independently. That process from when you enter graduate school to when you can hang out your own shingle independently after you get licensed can be anywhere from 7 to 10 years, sometimes longer. That's a long, arduous process. You tell me whether that's easy or not. But we're talking about digging around in people's minds. And we'll talk about the skills and training that clinical psychology programs believe it's important to have some experience and knowledge and practice and theoretical underpinnings in order to be practiced in your field in order to do the work. Med school, you get your MD, you get the same general skills, knowledge, training as every other MD, and then you get your specialty. This specialty is psychiatry, and then you get supervised, and then you get licensed. So it's the same kettle of fish as anything else, and same thing. You're talking about 6, maybe 8 years, maybe let's just say 8 years at the outset. You're trained from a very different philosophical approach, and you're trained in very different subject matter, and you're trained with very different experiences. And the experiences that you're trained in, and again, we're just talking psychiatry, don't necessarily map onto what you're called on doing from a clinical practice perspective, to the same degree that the clinical psychologist training does. And so we'll talk about that, why that may be the case, and how that shapes what you actually do for a living. So, with that in mind, let's move on to